Hello, everyone. Good morning. How are you doing? Hope you're doing great. Well, I say good morning. I guess it's good afternoon if you're on the East Coast. I'm on the West Coast. I feel like this is the Truman Show. Good morning, good afternoon, good evening, and good night. Welcome to our live stream today. If you're watching this live, this is going to be great today. If you're watching this after the fact, when I'm no longer live, then it's going to be worth it. So stick around. We've got some great stuff going on and good things to talk about. Today is October 14th. Wow. October 15th means that tomorrow is officially the start of Medicare's annual open enrollment period, or AEP for short. A lot of people call it open enrollment. It's annual enrollment. Uh, you know, eh, we can't just say things simple how they are or how they seem to be, but it's not open enrollment, it's annual enrollment. But it's the time of year when you can make changes to your plan, and that's really important. So I'm Calvin from PlanFit. Appreciate you being here with us today. I've been helping people for a long time in Medicare. This is my 16th annual enrollment period for Medicare. In fact, I've been doing AEP long enough that people used to call it open enrollment. But today we're going to talk about some of the big changes and things that are happening this year and things that you need to know about and be prepared for. Because honestly, this is the biggest Medicare enrollment period of the year, and it's arguably the biggest Medicare enrollment period that I have seen in the last 15 years. And that's for everyone on Medicare. It not only is it big because of all the changes and things that are happening in Medicare, but it is also your largest opportunity to secure the best plan for you in 2026. So you have to consider, what do I want to do? And that's really important, especially with all the things that are happening in Medicare right now. Now, today we're going to cut through all of the technicalities and the jargon, and I'm going to give you the things that you need to know for this annual enrollment period, and what you need to look at, what you should consider, and talk about the real particulars, not just of annual enrollment period in general, AEP in general, but of this AEP. But before we dive in, let me know in the comments, where you're joining me from and where you're tuning in from. Would if you comment, then I see it here on the stream, and I can I know kind of where you're coming from and maybe have some insight into the areas where you were watching from. And then also after this presentation, there will be time for me to do some question and answer. So if you have a burning question about AEP, about something specific, about something general, doesn't matter, you can put it in the comments. That will come to me here in the chat, and I will be able to respond to your specific questions. So if it's a question about annual enrollment period, choosing a plan, or switching a plan, or really anything related to Medicare, you can ask it in the comments, write it in the comments, and I will answer those questions today. So, okay, we've got a group of people on. We appreciate you joining us. Let's get started. And like I said, put questions in the comments. Put anything that let me know where you're watching from, where you're joining from in the comments, and I'll engage with you and look at your specific situation and your specific things. So, all right, let's talk first about annual enrollment period, what it is. So let's just do just a quick refresher. Stay with me. I promise I'm not going to get long-winded about stuff that you already know, but let's do a quick refresher on what annual enrollment period is and what it isn't, because sometimes that's an important thing to understand. So let me share my screen here and talk about some of this. And I just got to click right here. Okay. Hey, it worked. That's awesome. Hey, Tim from Nashville, thanks for joining. It's great to have you. Love Nashville. I always joke that Nashville is the Las Vegas sister city, right? I'm in Las Vegas, where we have all the bachelor parties. You're in Nashville, where they have all the bachelorette parties. So thanks for joining us today. Okay, let's talk about the annual enrollment period and what it is, what happens during that time. So of course, it runs from October 15th to December 7th. And October 15th to December 7th, that starts tomorrow. And when I started helping people with Medicare, we had just come out of the time when it ran all the way to the end of the year. It used to go to December 30th, 31st. The problem with that was, man, it ruined a lot of people's holidays. So, and that's a joke. It's not great that it happened over, Christmas and everything. But the truth is that people were signing up at the last minute on December 31st. and their plan was starting on January 1st because the coverage always starts on January 1st. And so the plan switched over and changed, and all of a sudden it was like, oh my gosh, I have a new plan, but I don't know anything about it. I don't have my cards. I don't have anything. I don't know how to access doctors. So they said, hey, this is the problem. We need to start. Since we need the plans to start on January 1st, we need annual enrollment period to end early enough that everyone has access to their plan on January 1st. And so that's why it ends on December 7th. December 7th seems like an odd number, a place for annual enrollment period to end. But it's because now you have 3 weeks before your plan starts. So you're going to get your plan materials, you're going to get your card and everything like that. So that's why it ends earlier instead of going to the end of the year. Let me just jump in real fast. Riva, thanks for joining us from Chicago. Riva, I love Chicago. In fact, I lived in Chicago for about almost 3.5 years. I lived in Jefferson Park. Then I lived outside of near Schaumburg in Mount Prospect. And Chicago, that was my early 20s. Like that, it has just a huge place in my heart. So thanks for being here. We got Dan from Broome County, New York, looking for the best and affordable Advantage plan in your area. Okay, Dan, we'll do some work on that. Thanks for joining us from Broome County. I'm not sure where Broome County, New York is. I'll have to look that up. But man, love New York. New York's a great place. Rochelle from Connecticut, thanks for being. Oh, Gary's back from Kentucky. Gary, good to see you 2 weeks in a row. Thanks for joining again. I hope everything's going well with, tomorrow you'll be able to officially enroll, but I know you had some specific things with medications we were looking at last week. So thanks for coming back. Appreciate it. Okay, so back to our slide here on annual enrollment period. What can you do during annual enrollment period? So we talked about when the time frame is and why it ends on this very odd and oddly specific date of December 7th, so that there's 3 weeks to make sure that your plan is starting and ready. So during that time, you can go from MA to MA. MA is my abbreviation for Medicare Advantage. Well, it's not mine. Abbreviation for Medicare Advantage. Medicare Advantage is the private option for Medicare offered by insurance companies. And it's one of the two paths that you can take. There's Medicare Advantage on one side, Medicare Supplement on the other. So during annual enrollment period, AEP, you can go from one Medicare Advantage plan to another. That could be even within the same insurance company. You could be in one insurance company and they have a new Medicare Advantage plan. You want to move over to that. We'll talk more about that later. You have to use AEP to move from one plan to another, even if it's with let's say you're with Humana, United, Aetna, Anthem, whatever, Kaiser, Scan, all of these different companies. If you want to move within that company to another plan, you have to do it during AEP. But it's also true that you could move to another organization. You could move from one company to another company's Medicare Advantage plan. You can also move from one Part D plan to another Part D plan. So this is not typically for people with Medicare Advantage, because almost all Medicare Advantage plans, you have to get your drug coverage from your Medicare Advantage plan. But hey, trivia moment here. Do all Medicare Advantage plans include drug coverage? No. And are there some Medicare Advantage plans that allow you to join a standalone prescription drug plan? Yes, actually, but not your HMOs, not your PPOs, only specific types. The Medicare Advantage, known as a private fee-for-service plan, PFFS, or in some cases, okay, I won't get in the weeds. So you can move from a Part D plan to another Part D plan, which that's typically for people with a Medicare supplement plan. So sometimes people say, oh, I have a Medicare supplement plan. I don't have to do anything during AEP. Oh, no, you still do. You need to look at your drug coverage, and you need to consider if you want to stay in your prescription drug plan or move to another prescription drug plan. Another thing that you can do is you could go from a Medicare supplement, MS, Medicare supplement, to a Medicare Advantage plan. You could drop your Medicare supplement plan, and you can't, when you switch plans from a Medicare Advantage plan to another Medicare Advantage plan, your plan is automatically canceled. So if you're on, let's say you're on an HMO Medicare Advantage plan, you move to a PPO Medicare Advantage plan, your old HMO automatically gets canceled. You don't have to call anybody. You don't have to call your insurance company. You don't have to go through that whole thing where they're trying to get you to stay and all that garbage, right? You don't have to do that. But when you go from a Medicare supplement plan to a Medicare Advantage plan, you do have to do that. You have to call your insurance company and say, I want to cancel my plan. Sometimes they'll say, well, you're going to have to send us an email or a letter or something, because they want to make sure that you really do want to cancel. Because when you leave a Medicare supplement plan, sometimes you can't get back. And so they do that all to, it's a cover their butt, CYB, I'll say, situation, but also at the same time, like, they want to retain you. And so you have to go back to original Medicare. You go back to original Medicare and then sign up for Medicare Advantage plan. It happens kind of in one transaction. You also can go from Medicare Advantage plan to original Medicare. So this is going the other way. Some people want to go from Medicare Advantage to a Medicare supplement or to original Medicare. You can do that during annual enrollment period. You could get out or cancel your Medicare Advantage plan. The most common and easiest way to do that is to instead of signing up for a new Medicare Advantage plan, sign up for a prescription drug plan, a standalone prescription drug plan. When you sign up for a standalone prescription drug plan, it drops you out of your Medicare Advantage plan and puts you back on original Medicare. And that might be the direction that some people are going to get a Medicare supplement plan. But if you're going that route, let me tell you that this is a master tip. Something I hope that you'll take away today if you're considering that. Make sure that before you move from a Medicare Advantage plan, to a prescription drug plan, before your Medicare Advantage plan cancels, apply for the Medicare supplement and make sure you got approved. And you can do that ahead of time. So right now, if that's what you're planning on doing, is going to a Medicare supplement, you should be applying right now for a Medicare supplement. And you do the application. We help you, or your local insurance agent who you work with helps you to apply for the Medicare supplement and get approved, because you have to apply and you have to go through health underwriting for most cases. And then once you're approved, now you go and sign up for your Part D prescription drug plan, and that removes you from your Medicare Advantage plan. But make sure you've been approved by your Medicare supplement first. Okay, so that's the overview of AEP from October 15th to December 7th. You can make all these moves: Medicare Advantage to Medicare Advantage, Part D to Part D, Med Sup to Medicare Advantage, Medicare Advantage to original Medicare. Those are the main things that you can do during this time. Okay, so here's the big question. If you are already happy or okay with your current plan, then why bother with annual enrollment at all? So I'm going to talk about two main reasons that you should still consider every year and review your benefits every year, because even if you're happy with your plan, there could be reasons why you need to review and consider another plan. So this is the why change plans during AEP discussion. And really it falls into these two categories. Number one, plans change every year. And number two, there may be a better plan for you. And there may not be. And so you should be careful who you get advice from, because some people will push and push, especially people who are, they only get paid if they sell you something, right? And if that's the case, then they may be selling you something that you don't need, or you already have something that's better. And so you have to be careful who you get advice from. So let's talk about these two categories. Plans changing every year. This is the first and most important of the two categories, I think. So what can happen every year? Every year your plan can change. Now, during this time of year, you find out the plan changes for Medicare Advantage plans and for prescription drug plans. You don't find out the changes for a Medicare supplement plan this time of year, because Medicare supplements intentionally, they make their plan changes during the middle of the year, because if they change plans now, you might leave them, and you can leave them right now. So sometimes with Medicare supplement plans, you have to consider what's happened in the past, or consider where you're at financially if you're going to leave a Medicare supplement plan. Over the last 15 years, I have seen so many people moving from Medicare supplement to Medicare Advantage. It's kind of been the trend. I don't know if that trend's going to continue long term. We're kind of at a point now where I think it's kind of stabilized, where the people who really wanted a Medicare supplement and are willing to pay for it are there. The people who wanted to save money and go on the monthly, not just because you go to Medicare Advantage doesn't mean you save money all the time. But the people who wanted to, who were, it depends on your area, and in some cases it's a no-brainer on the cost, and in some areas maybe not. But they go to the Medicare supplement. That balance is kind of there now, where I don't know that people are going to go back and forth as much anymore. But we've seen this trend. When I started in Medicare 15 years ago, it was somewhere around 28-30% of people with Medicare had a Medicare Advantage plan. Well, this year it hit 53%. So it's almost doubled And Medicare Advantage plans have become very, very popular. It doesn't mean it's the right thing for everybody. And part of the thing that we do here at PlanFit is, that I'm very adamant about, is that we stay unbiased. And it's not just that we're unbiased and we're like, well, I think this side is better, but I'm going to tell people that it doesn't matter what you choose. Not that. What I mean by unbiased is we have done the deep study and research and understanding to say that there is a right plan for you, and that is different than your neighbor. And for me to say this is the best plan for you, not for you, but this is the best plan for everybody, is wrong. Because the reason why so many plans exist and why there's membership in all different plan types is that everyone has different needs, desires, wants, budgets, etc. So it's good to have a lot of choice. And so we help people with all the different plans, and we see where every plan type has a place and a need. So what changes in your plan? Well, pricing. Does the price change? With Medicare Advantage, we are seeing, particularly with PPOs, a massive exodus of PPOs. And then the PPOs that aren't going away, many of them are adding premiums. Now, this isn't everywhere, but a general trend on pricing. So, is your premium going up? What about copays? Are you seeing increase in copays or decrease in copays, right? Because for the last several years, I've had a really fun job. I have been able to come on here and tell you all, hey, great news. It's all getting more affordable. And this year, I don't necessarily get to say that to a lot of people. So that's a difficult thing. And by the way, if you don't follow me on YouTube, or you're watching us on social media or whatever, please follow us on YouTube. We are trying very hard to grow our YouTube channel because we're giving such good information, and we really feel that there are people that need to hear what we're doing and what we're saying. But okay, networks. What can change your network? Well, this time of year, they will make major network changes. They might say, hey, next year, we're not going to have this entire network of doctors or this entire hospital system. But the ugly thing with networks is that networks and doctors, individual doctors in particular, can come in and out of a Medicare Advantage plan in the middle of the year. They don't necessarily have to stay all year like you do. Drug coverage is the biggest change that we've seen over the last 2 years. Unless you have had your head in the sand, you know that there has been a major change to drug coverage. Or maybe you're new to Medicare, but if you've been in Medicare for longer than a day, you know that there used to be something called the donut hole. And it wasn't, a crispy, fried, delicious treat. It was terrible. When people went into the donut hole, they had massive costs on their prescription drug coverage. 10 years ago, it wasn't unusual for me to see people paying $6,000, $7,000 a year for their medications. Well, now it's been capped because of the Inflation Reduction Act at $2,000, and in 2026, it'll be $2,100 is the maximum on medications. So this has been really, really amazing and fun for me to tell people that, particularly people who are spending a lot of money, that their drug coverage is going to cost less. But unfortunately, it costs a lot of money to offer that much more benefits. In 1 year, the max on drug coverage on average went from about $4,000 to $2,000. So it cut in half. But in that same year, plans did not receive more money from the government. So they had to take the money from elsewhere. And that's part of the reason why we're seeing, pricing change and networks change and even extra benefits change because of this additional benefit in drug coverage. And, for me, I would say that I am very happy to see the donut hole close. And I think if money has to come out of extra benefits on dental, vision, and hearing in order for drug coverage to come down, then maybe that's a trade-off that we needed to make. I don't know, but it's really hard for me to tell my clients that, hey, I'm sorry, but your dental coverage is going to be less next year. It used to be $2,000 a year, and now it's $500. So that's where the money had to come from. It had to come from somewhere to offer this drug coverage benefit. But for a lot of people, that's a really positive thing. Some people, it's a little painful. But these are the things you need to look at every year with your plan to say, what is changing? And the way you find out what's changing in your specific plan is you read your annual notice of change letter. So once a year, your plan sends you this letter. It should come by September 30th, so you should have already received it. And it may come by email if that's how you receive your notifications. It may have come through the mail. And, you get so much junk and crap and statements of benefits and all this stuff. I mean, how often do you see stuff from your insurance company and just toss it away because you're like, oh, yeah, I went to the doctor. They're sending me a summary of benefits. Well, this is one you don't want to miss because it specifically tells you what's changing in your plan. And it's really hard to figure that out without this, because otherwise you need to look at your plans documents from last year and look at your plans documents for next year and try to figure it out. With this one letter, they tell you everything outlined, or at least everything that they're required to tell you. It also will tell you if your plan's just going away, which is happening this year with 2 million people losing their Medicare Advantage plan, mostly PPOs this year. Okay, switch over to the other side. Better plan for you. Sometimes, okay, when we talk about a better plan for you, these are some of the categories you need to look at. The core benefits, the extra benefits, dental, vision, hearing, over the counter, those types of things. A wider network, having access to more doctors, or maybe just reducing the cost going down. So a lot of times people think, we talk about a better plan for you, and I see people's eyes just like glaze over. So let me engage with you with an analogy that will help you understand why this is important and why maybe it's not what you think it is. Because sometimes we say a better plan for you and you're imagining, oh my gosh, this is going to be a pain. Like, I hear what he's saying, but I'm with XYZ insurance company, and I'm sure he's going to tell me that I need to go to ABC insurance company, and I'm going to have to change everything. And what's going to happen with my doctors? Are they even a good company? Are they going to be around? Like, it just sounds like a who moved my cheese thing, right? But here's what happens most of the time, honestly, is that the better plan for you is from the insane insurance company a lot of times. And that's what we've seen a lot. So I relate this in my analogy to a cell phone carrier. And okay, as I give this analogy, I want to say that some of this is not the insurance company's fault. Sometimes the way that the system is built, they have to do this, but it could be really frustrating. Have you ever gone to the AT&T store? I'm with AT&T. Some people are T-Mobile, Verizon, whatever. Have you ever gone to your carrier store because you're having a problem with your phone, or there's some issue, and you go in there and they say, "Hey, you're on an old plan, and your old plan costs $200 a month, and we came out with this shiny new plan that only costs $100 a month and has unlimited this, that, and the other, and you can travel to Mexico and blah, blah, blah. When you're on a cruise, you have cell phone coverage, all this stuff." And you're like, geez, thanks. Thanks for telling me. Except, why didn't you tell me 2 years ago when you came out with this new plan? And you kind of feel like, hey, I think you kept me there because you were making money on me, extra money. I was paying $200 a month for this cell phone plan, and you had a $100 a month plan that was better. And you didn't just move me there? Like, why didn't you just make my plan better too? Well, unfortunately, they were profiting from you, right? And so they left you there. Now, the same thing happens in insurance, and we're seeing quite a bit of it. That an insurance company has a plan, and you're with that plan, and they have a new plan. And guess what? That new plan has all your doctors, and it has all your drugs, and sometimes it's more affordable and has extra benefits and a wider network and core benefits. So why do they do this? Well, not all of it is because they're big bad insurance companies. I actually defend insurance companies a lot in my posts because I understand how the system works and I understand why they're doing things that they get badmouthed for. For example, let's say that an insurance company has a really successful plan in another state, and they want to bring it to your state. That plan has high ratings. Maybe it's in maybe they are working together with an organization, like a large organization. Maybe they're working together with AARP. Maybe they're working together with a hospital group or a doctor network or something. And they're like, hey, we want to expand this plan into another area, and we have great support and backing. And so they do. They're not allowed to transfer people from one plan to another. Only you can make that decision. So there are many reasons and many times where an insurance company brings a new plan in, and oftentimes we as certified Medicare insurance agents, not certified by Medicare, I have to be careful I say that, we get certified to represent Medicare plans for the insurance company. But having those certifications, the insurance companies will come to us and say, hey, look, you have 500 clients, 1,000 clients, 10 clients, whatever. You have people that you have helped that are on this old plan. Will you please reach out to them and tell them that there is a new plan available that's better? We have that happen all the time. So I don't want to say that the insurance companies, are intentionally leaving you in the dust, because most of the time they're not, but they can't move you without your permission. And if you're an orphaned, we call you an orphaned client, you're a sad orphan out there with no agent, then no one's going to tell you. And that's one of the most important reasons. Honestly, there are many important reasons, but that's a very important reason to make sure that you have a representative, that you have an agent. If you call an insurance company and you sign up with that insurance company directly, can I just say, shame on you? If you call a 1-800 number on television, shame on you. I'm sorry for being so bold, but now you don't have a representative. You don't have someone watching out for you, because the person you called works for a call center or works for an insurance company, or if you call 1-800 Medicare and they refer you to a SHIP counselor, those are either government employees or government volunteers. So what do you have? You have someone who represents the insurance company, you have someone who represents a call center, you have someone who represents the government. Well, who represents you? That's why you need an independent insurance agent. I was shocked to find that only 30% of people who sign up for a Medicare plan sign up with an insurance agent. Only 30%. That means that it's 33 or whatever. So 1/3. The other 2/3 of people have no representative, have no one that represents them. Instead, their representative, well, they don't have one, but the person they worked with represented other interests, represented an insurance company, represented the government, represented a call center, whatever it was, right? So they don't have someone that represents them. And so, so that's how it happens. That's how you don't know that your plan has changed, because you don't have a representative that represents you. So I don't understand why only 1/3 of people use an independent broker. Honestly, it should be everyone. And we'll talk more about that in my next slide. Okay, that is the why change plans, better plans. Plans are changing every year, and you don't need to get caught off guard by this if you review your annual notice of change. That's the most important thing I can tell you right now, is find out what changed. So, okay, this begs the question, how then, if you're going to look at what's available in your area and you're going to shop around for plan and things like that, how then do you shop for plans in your area? And how do you go about it? So this is my next slide, but let me just set it up with you. Honestly, the best way to find plans available in your area, which I already shared, is to work with a licensed insurance broker. I say the word broker because a broker works with all insurance companies, or at least multiple insurance companies, or at least can look at all the available options, and they're not working with just one plan. So you could also go and use Medicare's Plan Finder tool on Medicare's website. But again, you will lack a very, very crucial detail, which is the independent broker who represents you, your representation. Also, on Medicare.gov, it doesn't show you all the plans, networks, hospitals, and pharmacies, the doctors that take the plan. You can't really find that. It doesn't show you the full list of medications that are covered. So there's just a lot missing there. I mean, every plan, I've shared this before, but I've got a few props here with me today. I got the Medicare and You handbook. Man, this is actually a very useful book that has a lot of great information, and I study this because it's well done. I've studied, I practically memorized. But every plan has a book this big. So if you're signing up for a plan, it has a book this big. Well, you're not going to find all that information on Medicare.gov. So let's go to the next slide here, and let's talk about how to find the right plan for you. And I'm going to talk through these things. It doesn't look like much, but there's a lot to discuss in here, and it's really important. Number one is your situation. And when I say your situation, what is your medical situation? Are you seeing a lot of doctors? What is your physical health condition? I mean, the reason for insurance is to prolong your life, right? We want to extend your life and help you to live a longer. The other reason is to enjoy that extended life, right? So what is your health situation? What would help you to better that? That should be the foundation. People will call us sometimes and be like, "Oh man, I saw on TV that I can get money back in my Social Security. There's plans that will, pay part of my Medicare Part B, whatever." That's great. Let's see if there's one of those that fits for you. But let's start with the core benefit of your health, because that's what you have your insurance for. And so, people will call us and say that they want that benefit. Well, the plan that offers that benefit to them in many areas doesn't have the strongest core benefits. and we find out that this person who wants that money back in their Social Security maybe has diabetes or has, neuropathy in their feet from that or things like that. And I'm like, it might be nice to get $100 back in your Social Security, but you need to take care of your health. That should be the core. So health is a big one. What about your financial situation? What can you afford on a monthly basis? That's a big thing. Another part of the situation can be, what have you experienced in the past? What did you like and dislike about past plans that you had? You need to consider those things when selecting a plan. Number 2, doctors and drugs, the 2 big Ds. Doctors and drugs is the foundation of choosing a new plan for you and choosing the right plan for you. And when I say doctors and drugs, I'm talking about which providers. Provider is a word that we use that encapsulates all doctors and medical facilities, hospitals, and everything else. And we call them providers. That's kind of the trendy term for all doctors and, Quest Diagnostic and all those, we call them providers. Which of those do you want to see? And do a search and find out which plans they accept. That is one of the hardest and most difficult and challenging things to do, because there isn't one place that you can go and find out, oh, I just want to know, does Dr. Smith take, which plans does Dr. Smith take? Instead, what we do is we go and we research each plan. Sometimes we can start with the doctor and say, hey, doctor, what do you take or whatever, but we find out, what does your doctor take? And when you're considering your doctor and your situation and everything, sometimes it's a balancing act. I really, really, really want to see this doctor. Okay, we found this doctor, but guess what? They only take expensive insurance. So you're going to have to make a trade-off. Do you want to pay for expensive insurance to see that doctor, or do you want to change doctors, right? It all becomes this trade-off situation. Because oftentimes people have multiple doctors that they want to see, specialists and what have you. Then there's another consideration. What are doctors that maybe you've never seen that you want to know you could see in an emergency if you wanted to go to? So maybe that's out-of-state doctors or something. So we need to consider doctors. Drugs means your medication. What medication are you taking? This is a little more straightforward. We take all your medications, put them into the software, and it says, based on that list of medications, and this is the plan that covers them the best, and this is the plan that covers them the second best. And we actually know for the entire year what your costs on drugs are. Really critical component, doctors and drugs. Then finding the plan for you. So we take that information and we say, okay, let's do our trade-off time. Trade-off time. You can't have all the doctors, or you can have all the doctors, but if the plan that all the doctors accepts doesn't cover this one medication you have. So these are the trade-offs that we work through over and over every day. It's what we do every day, is helping people make those trade-offs and help them make their own decision. Because oftentimes people are like, oh my gosh, what am I going to do without my medication? And we say, well, maybe you should go back to the doctor and say, here's the list of medications that, because every plan has to cover at least 2 medications in every therapeutic category. So, would one of these other medications work for you? If the answer is yes, okay, work with your doctor to switch medications to go on the plan that the doctor takes. So that's helping you find the plan that's the best fit for you. Then it's paperwork time. Paperwork gets better all the time. It's not like the days when I had to fill out the paperwork, have you sign it, and fax it in. Although I laugh about that, this is crazy. We received word just this week that some insurance companies are trying to limit enrollment into their plan and have removed their plan from all electronic enrollment software. And so the only way that we can enroll you with certain plans is to do paperwork and fax it in 2020 for 2026 plans. Can you believe that? And it's something that our association is fighting heavily to say, that's not right. Yeah, either you offer the plan and it's open, or you don't. And so I say complete paperwork. Usually it's a breeze, but sometimes it's not. And we make sure that it goes through. But after completing the paperwork, we also need to make sure that your plan actually starts and that everything goes through, because sometimes it gets, there's a hang up or something catches them. And then we get to the number 5, which I put in here in finding the right plan for you. And I've been harping on this a little bit today, but you need a long-term advocate. So the reason you have a plan is for your health. What happens when you go to the doctor and your insurance agent said it was going to be $10 and you get a bill for $1,000? Has this ever happened to you? Virtually raise your hand. We see it, unfortunately, too frequently. And do you want to deal with all that headache? or do you want to have someone that can help you? That's also what we do, is we help you long term to make sure your plan does what it said it would do and lives up to what it said it would live up to, whether it's, billing issues or prior authorization issues or not getting in to see your doctor. We had a client that called us. This is a true story, one that I'm very proud of. One of our clients called us and said, "Hey, I signed up with you for my plan. I'm in the doctor's office and they say they don't accept this insurance." And they were frustrated with us, and I don't blame them. But what had happened is this medical group, it was January, and they had just started taking this insurance. And so the staff in the office didn't know as much as we did. They didn't know that, yes, they do take that insurance now. And they had been used to, for many, many years, to telling people when they saw that particular insurance card saying, "Oh, no, we don't take that," and turning people away. And so we've got this senior with Medicare standing in the lobby, almost on the verge of tears, because she needs to get her prescriptions refilled, on the phone with us saying, "You signed me up for this plan and the doctor says they don't take it." And so we said, hold on. We're going to fix this right now. Don't go anywhere. Well, we had connections with the medical group. And so our service team called the medical group on the other line and said, "Hey, we've got this person who signed up for the plan. They're standing they're standing in the office right now. They were turned away." And they think it's our fault, of course, but they were turned away. And that connection with the medical group called the front desk and said, "Hey, you see that woman standing in your lobby on the cell phone on the verge of tears? Go and get her now and apologize to her and make sure that she's seen by the doctor. We do take that insurance." So this is a real life example of why you need to have advocacy and making sure that your plan works for you. So that's finding the right plan for you. So I'm going to come back to me. Wow, that's a big picture of me. I want to remind you that all this starts tomorrow. So make sure that you have reviewed your annual changes of notice document, and don't forget to call us if you need help finding the better plan for you. So with that, I'm going to go into some questions that we have and answer some of your questions that you have put into comments, and go a level deeper here. So let's see. Let me look what we have here. Thoughts on a plan G. Rochelle said, high deductible versus high MOOP Medicare Advantage. Okay, wow, Rochelle, this is a great deep question. Thoughts on a plan G. Okay, a plan G is a Medicare supplement, and a plan G has the Medicare supplement with the most benefits of all Medicare supplement plans. It used to be the plan F. If you had Medicare prior to 2020, and you could still get a plan F, although I would advise against it. And now plan G is the highest level plan. You have to pay your Part B deductible, and after paying your Part B deductible once a year, it covers everything else health related. There is also something called a plan G high deductible. Now, a high deductible plan G is like a plan G, but it has a deductible, and it still covers everything for you, but after the deductible. And so think of it like similar to the type of insurance maybe you had when you were working that had a deductible. You paid most everything out of pocket until you hit that deductible. For a plan G, the deductible is $2,870. So you have to pay the first $2,870, and then after that, your plan G covers the rest. And then, so I'm talking about the three categories, and then there is the high deductible MOOP Med Advantage. MOOP stands for maximum out of pocket. Good job, Rochelle. One of my favorite acronyms in Medicare, MOOP, because it sounds funny to say. And with a Medicare Advantage plan, most Medicare Advantage plans, you just have copays, and they're not, and they're manageable. But if something major happens, like let's say cancer, this is one of the places we see people hit their MOOP all the time. If you have cancer, you're going to pay 20% of all your cancer treatments. It's very likely you're going to hit your maximum out of pocket. And if your maximum out of pocket is $8,000, well, you're going to say to yourself, man, I wish I had just paid the $2,000-$3,000 a year for a Medicare supplement plan, and that would have saved me money. But do you have cancer every year? No, most people don't, right? Or have a major health thing every year. Most people don't. Although as you get later in life, you're probably going to have multiple years near the end of your life where you'll have, a lot of health things. That's pretty common. But if you have a major health thing this year and then next year you don't, well, if you're not hitting your maximum out of pocket every year, then you're going to make up for it, the Medicare supplement thing. So there's kind of a back and forth on this. So Rochelle's question was, Plan G versus high deductible versus Medicare Advantage. Actually, you said Plan G high deductible versus Medicare Advantage with a high maximum out of pocket. In most cases, I would probably lean towards the Plan G high deductible over the high maximum out of pocket Medicare Advantage plan, because you eliminate a lot of things that can be a challenge, like prior authorizations and the need to get referrals to see specialists and what have you. And the high deductible can make a lot of sense for a lot of people. I haven't really shared this in my videos, but my own mother was on a Medicare Advantage plan, and it got very expensive. She lives in a rural area, a very rural area, where they've gotten down to only 2 Medicare Advantage plans in her area to choose from, and they both got expensive. And the one that she was on backed out and left the area. Well, if your Medicare Advantage plan leaves, you can go to a Medicare supplement plan, no questions asked. So my mother actually moved from a Medicare Advantage plan to a Plan G high deductible, and that's what my own mother has right now because of the rural area that she lives in and the options that are available to her. If she lived in Las Vegas here, there are so many incredible Medicare Advantage plans. She probably wouldn't want to spend money on a Medicare supplement based on her own preferences. So, but where she lives, it makes a lot of sense. So yeah, I don't know if that helps, Rochelle, but generally speaking, if you've got a Medicare Advantage plan with a really high MOOP or has high copays or the PPO Medicare Advantage plans, I've often told people, I personally, I think that the decision most of the time, again, I've said that there's a place for everything, but most of the time I would say the decision should be, do I want to have the Medicare Advantage HMO with great benefits, or do I want to go to a Medicare supplement plan and have full access everywhere I go, but pay the money? It takes money to do it and be there. And I think that's, if you're looking at the purest of the Medicare Advantage plan and the purest of the Medicare supplement plan, it really is a choice between a Medicare Advantage HMO or going to the other side on a Medicare supplement plan. So Rochelle, I would probably lean towards a Plan G high deductible in that situation, but every situation is different. Okay, here's another question we have. What should I do if my drug is moving to a higher tier next year? Okay, we are seeing some of this where your drug was covered under a lower tier. It was covered under a under a tier 3, and it moved to a tier 4 or whatever tiers your company uses. Well, in that case, what you should do is you should have your medications reviewed and have your medications, all the medications you're currently taking, based on their quantity, the quantity you're taking, and what the dosage is. You should have those reviewed, put into the system to see which plan covers them better. Sometimes you'll find that everybody is raising the tier because the brand it became more expensive. But I would say definitely you should have your plan reviewed. Okay, let's see. You're welcome, Rochelle. I see that. Thank you. What if I drop my Medicare Advantage coverage and I get denied by a Medicare supplement plan? Well, I shared earlier, if that happens, you did it backwards, and unfortunately you did not have good advice. So here's what good advice looks like. Apply for your Medicare supplement first, find out if you're approved, and then drop your Medicare Advantage plan. And if you're considering going to a Medicare supplement plan, like Rochelle asking about the Plan G high deductible, then you should be applying for that now so that during AEP, you know that you're approved and you can drop your plan. I hope that helps. Okay, here's, let's see, here's another one. What if I sign up for a plan, but I realize that there's an even better one available in my area? Okay, during AEP, you can make multiple changes. It's the last one that sticks. So don't feel afraid that you're going to make a mistake and find that there's something else later. You could have more than one enrollment during AEP. So, and by the way, let me say to Dan. I'm gonna answer your question. I'm gonna do a search on your question next, but I don't know your zip code. If you want to put your zip code in the comments, I'll use your zip code. I'm giving you time to do that. Otherwise, I'll look up a zip code that I can hopefully find in Binghamton, New York. Okay. So going back to this, what if I sign up for a plan? I realize it's not the best plan. During AEP, you can make multiple changes. If you sign up for a plan and then you realize, oh, no, I don't want that, you could move to another plan. It's the one that you have enrolled on December 7th that will stick. I don't recommend jumping around doing a bunch of that, but it's good to know that you can and that you can change. So I'll give you a true story that happened. I'll say it's a true story. I don't even have one story. This is like 1,000 stories. On many occasions, we've had people come to us and say, and we've run other medications, we have looked at their doctors, and we have helped them enroll in a new plan. And 2 weeks later, they come back and say, you know what? I changed my mind. I'm going to stay with, and usually it's like this. I moved to another plan because my doctor's leaving. And they come back to us and say, oh, I'm too nervous about it. I've decided I'm going to switch doctors and stay with my plan. Okay. And what we say to that is no harm, no foul. It's okay. And in fact, we can help you to enroll back in the old plan. And when we help you enroll into the old plan, we also become your agent and you can rely on us long-term. So it's okay. It's just fine. So we help that person to enroll in their old plan, choose their new doctor, and go back on their plan. Well, it wasn't necessarily a bad situation for them because by December 7th, they were back enrolled in the plan that they had before, and now they had us as their agent long-term. So, it's okay. You can make multiple changes during AEP. Just make sure that the one that you're in on December 7th is the one that you want next year. There is also the open enrollment period. And I say open enrollment, you think that's the end of the year? Nope. End of the year is annual enrollment. Open enrollment happens in January, from January 1st through the end of March to March 31st is OEP, open enrollment period. And during OEP, you can change your plan one time. If you change your plan during AEP and then they found out it wasn't right, from January to March, you can make another change. Most people don't know this. And part of the reason most people don't know this is, guess what? From January to March, when you could make one change, if you didn't like the change that you made in AEP, I'm not allowed to advertise that. I'm not allowed to, to market to people. I can tell people, I can put out an educational video about it, but if you're not following us, which by the way, if you're not following us on YouTube, I've already said this, but you should be. If you're not following us, you're not going to know. So there are a lot of people that don't know that from January to March, they could still fix whatever went wrong during AEP because they get one chance to do that for Medicare Advantage. So anyway, yeah, that's what I think about changing plans in your area. Okay, Don, you gave me your zip code. So we are going to do a quick search here. And we did this a little bit last week, and I think it was very popular and very well received, showing people how to do some work on their own and give them some insight into what we do as insurance agents. Not all, we don't. Sometimes we do use Medicare.gov, by the way, but we also have our own software that we use to do searches and things. But okay, so we're going to Medicare.gov. We're going to do find plans, and we're going to do the zip code of, let me see, 13790. 13790. Search. And we're going to look at Medicare Advantage plans and find plans. We're going to say we don't have Medicaid or extra help, and we're not going to put in medications this time. We've done that in the past some. So let's continue to view plans. Okay. All right. There are, in Broome, New York, 27 Medicare Advantage plans. And if I add in the special needs plans, there are 48 Medicare Advantage plans. In 2025, there were 58 total plans and 40 regular plans. So you have lost 13 Medicare Advantage plans in your zip code. That's pretty significant, Don, and that's what we're seeing. We're seeing this a lot all across the country, as particularly in upstate areas. I don't know. I haven't had a chance to look and see where Broome is. Just for fun, Broome, New York, because I like to know who I'm talking to and where you're from. Okay, I see Livingston. Okay. South and east of Albany. What a beautiful place. Okay, that's great. Okay, so I get an idea. You're south and east of Albany, New York. Okay, so in that area, you've lost 13 plans. And anyone who's on one of those 13 plans, you have a guaranteed right to go to a Medicare supplement plan, or you can choose one of the other plans available in your area. So the first thing that comes up is the Aetna Medicare Eagle Give Back Plan. Now, anytime I see the word Eagle, this is a PPO, when I see the word Eagle, I know that this plan was designed for veterans. And then I look to the right, doesn't include drug coverage. Those patriotic names and words, those usually mean that this is a plan designed for veterans that does not cover drugs, because veterans get their drugs from the VA. Not all veterans. You as a veteran, you could choose. You could say, I want to have access. I want the VA for drugs, and I want to be able to go to Walgreens or CVS or Walmart or whatever. You can have it both ways. You don't have to use the VA for drugs. But if you join this plan, you do have to use the VA for drugs. So that's the first one that comes up. I do need to go back, and Don, and read your previous comments. I'm looking at the Humana zero copay for doctors, zero for prescription, and give back. Your thoughts? Okay. Well, this will be interesting. Don, in full disclosure, I don't know enough about you to give you a recommendation, but I will give you thoughts. Okay, so the Aetna Signature PPO comes up. The MVP Gold HMO POS. Last week we talked about the POS. It's not the POS. It doesn't mean POS like some people say when they're cursing. A POS gives you a point of service, which is like a limited PPO. Sort of. It lets you go out of network to get like a second opinion on something. So that's what the POS gives you. Now I'm seeing a lot of 7,200 max out of pockets, 7,500. I see the WellCare going down. Medicare, the Exelis Health, multiples of those, more WellCares, Humana USAA Honor. You notice no drug coverage. Clearly another veteran plan. Let's go the WellCare, Fidelis, 9,200 max out of pocket, Aetna, WellCare, Humana Choice Give Back. But I think you said Humana zero copay for doctors. I think this is the one that you're looking at. So let's take a look at this plan. It'll be interesting. Okay. Actually, let me just double check if there's any Humana Choice PPO. This is probably the only give back. I'm just going to go to all the way to the third page. It looks like you have limited Humana options in your area. Surprisingly limited, given what the number of plans that Humana often has in different markets. So I'm sorry if I'm making you guys dizzy. I apologize. Okay, I'll stay here. The Humana Choice Give Back Plan. Okay, this plan has the zero copays. This has got to be the one you're talking about. So at first glance here, I see that it has a zero premium, and it has a give back feature, which means it's going to pay part of your Medicare Part B for you. Let's look at some plan details and dig in and just get a feel. So health deductible, $330. I would assume that health deductible is probably out of network, but we're going to double check that. This has a $55 Part B reduction. That means it's going to pay $55 of your plan. So you're looking at that $660 a year, right? That you would receive back. So the question really here is it worth the $600 a year to take this plan? And is there another plan that would give you more benefits or that you would use more instead of the $600 a year? And I don't know that I'm going to have time in 5 minutes here to give you that full answer, but that's the question that I would ask is $660 a year, am I going to make up for that somewhere else? And is there another plan that has more over the counter or more dental benefits or more affordable other benefits? And what is my health, et cetera? The fact that you're looking at this plan probably tells me it's likely that you're healthy. And you asked about the primary care doctor, or you mentioned the primary care doctor is your premium. If that's the only doctor that you primarily see and you're in good health and you're like, hey, listen, I'm not going to use all this other stuff. I just would rather have $600 towards my Part B because that gives me money back in my Social Security. That's what I would look at. That's what I would say. I would say this is a good option for someone who is in good health, is unlikely to use their plan, realizes that they're taking a little risk because the max out of pocket was higher, but says, you know what, I'm really almost not really going to use the plan much, and so for the few things that I use it for, it makes sense. That's how I would look at this. Let me see what else I can see, because I said, you notice it had the $9,250 in-network max out of pocket. The best plan, the best maximum out of pockets that we saw in the area were somewhere around $7,000. So in a worst case scenario, saving that $600 a year could cost you, over $2,000 in a worst case scenario. But again, I would say this is a are you in good health scenario. If you're in good health, this has access to the doctors that you have, and you're willing to take that risk to say it's unlikely I'm probably going to save money by having the give back, then it's a good choice. If otherwise, no, it's not. If you're seeing doctors and you're like, I need to consider, my health, then you may want to look at one of these plans that has a lower maximum out of pocket that also includes your doctors. But again, that's just an example. Oh yeah, let me show you this is the give back. This shows you why someone with VA benefits would consider the Humana USA a give back and get their drugs elsewhere. If you don't have drug coverage and you do the USA a give back, your max out of pocket is only $4,950. So what Humana has done is they've taken the money they would have spent on your medications and they've put it into core benefits. So for a veteran, this makes more sense than, because they also are getting a $110 reduction. So you can see how the veteran plans become really popular for veterans, because you get extra benefits because the plan doesn't have to pay for medications. Yeah, so that's what I would say, high level there, Don. I hope that's helpful. I think a lot of that consideration would be, what is your health? And are you going to use your plan? And if you're really just not using your plan and you're like, I just need to go to my primary care doctor and get my checkups, and something could happen. If it does, I can cover that. But if it doesn't, I think it's going to work out. That's the consideration that I would make. Let's see. We are running out of time, but let me just answer one last question from Gary, because Gary, you're here 2 weeks in a row. Do you qualify as super fan at this point? Like, do we need to send you some merch? It says, what if you take an expensive medication and it's covered by J&J assistance? Should you add it to your Part D drug list to compare plans? You're talking about Johnson & Johnson. Okay, this is a challenging spot, Gary, because technically, you didn't hear it from me, but Johnson & Johnson and other manufacturers, if they know you're on Medicare, they are technically not supposed to provide assistance to you. They are required to stop all assistance for people with Medicare. They can't have extra things. You're not supposed to be able to use coupons. You're not supposed to have, when you watch all those commercials on TV and they're like, you could get help with this medication, call for assistance if you can't afford it and we'll help you, right? And you see that on commercials a lot. Well, if you qualify for Medicare, you are not supposed to get any of that assistance. So I don't know what your situation is and how that's working. I don't want to mess anything up for you, but I'm just telling you what you need to know is they're supposed to put everything onto your Medicare plan, which thank goodness for you, Gary, because we ran your medications last week that there's a $2,000 max out of pocket, or else you would really, really be in a world of hurt. I think what we ran last week said that you would pay $100,000 for your medication, and you're taking it every other month. But if you were taking it every month, it would be $200,000 for your medication. So what can you do in that situation? Let me just finish up with this, and this will be my last question answer. There is a program that started because of the Inflation Reduction Act that could really help you, Gary. And what it does is, it doesn't take away the cost. you're still going to have the $2,000, but it can take the $2,000 and it can average it out over 12 months. And then and by the way, next year it's going to be $2,100. So it can take the $2,100 and it can average it out over 12 months, and you get billed monthly and you pay for it monthly. So 2,100 divided by 12, because I can't do math that fast in my head unless it's easy math. That's $175 a month. So you should contact your insurance company right away if you want to participate in that, and tell them that you want to average out your medications over the course of the year. And then you would pay $175 a month instead of paying $2,100 in January. And hopefully that could make it more affordable for you. But technically, manufacturers are not supposed to give assistance to people with Medicare, believe it or not. Yikes, I hate saying that, but that's the truth. Okay, if I wasn't able to answer your question, you can call or text the number on your screen, and one of our PlanFit agents can help you. As I've shared with you, there's so much benefit to having an independent agent on your side. No one here at PlanFit is paid commissions. Every agent here at PlanFit receives a salary, and they have insurance. We pay for their insurance, we pay for their benefits, we give them salary so that they can be unbiased and can assist you with every plan available in your area, and even will recommend plans that don't directly work with insurance companies or insurance agents, because their goal is to be unbiased and find what is best for you. So other than that, thank you for watching, and don't forget that AEP starts tomorrow. We'll see you next time. Bye-bye.